Good evening, everyone. Thank you so much for joining. Our facilitator will be with us shortly, so kindly hold on, please. Thank you.
Hi, good evening, everyone. Please, can I be heard?
Yes, please. Good evening.
Good evening. Right. My laptop is freezing this evening. We thank God once again for bringing us together to continue with our discussion. My name is Kwesi Tagbor, and over the period, or for some time now, we've started a series on anxiety disorders. A series on anxiety disorders, and today we are continuing from where we stopped. Yeah. So we are continuing from where we stopped last week. So over the period, or those who are joining us for the first time, we looked at yes, those who are joining us for the first time, we started this discussion for a while now. We've discussed that of generalized anxiety disorders. We've also looked at acute stress disorder in the past. We looked at panic disorders already. 2 weeks ago, we looked at social anxiety disorders. So today we are continuing with specific phobias. We are hoping, if time allows us, we should be able to finish today. However, if we're not able to finish, wherever the time will take us to, we'll end there and continue next time when we meet. So I want to also acknowledge that this is a Ghana Growth Project under the Springboard Roadshow, an initiative of the Springboard Roadshow with support from MasterCard Foundation and partnered by the Ghana Psychological Association. So to begin with, I just want us to share in this scripture. We are talking about anxieties, and there may be people, someone may be going through some issues that are keeping him or her worried, anxious, doesn't know where his or her help is coming from. I just want to give you some words of comfort. If you should read Isaiah chapter 41, verse 10, the Bible says that, "Fear not, for I am with you. Be not dismayed, for I am your God. I will strengthen you, I will help you. I will uphold you with my righteous right hand." So, ladies and gentlemen, I just want to assure everybody here that regardless of what you are going through, God has assured that He is always with us. It's just a matter of time, and He will reach out to you. Call on Him. Don't let the faith diminish. Sometimes it may be very difficult that all hope seems to be lost. And at that very moment, we are tempted to say that God doesn't love us or God is not there for us. But I just want to let us understand that Isaiah 41 verse 10 has assured that God is always with us and He doesn't change. He's always God and He will be with you always. And then if you take Genesis chapter 28 verse 15, it also said, "Behold, I am with you and will keep you wherever you go and bring you back to this land. For I will not leave you until I have done what I have promised you." Hallelujah, if I'm in the church. So I just want to assure you that God has
Amen.
perfect plans for you, and He will not leave you until what He has promised you comes to pass. Amen. So on that note, we want to look at specific phobias. So just as the word suggests, specific, it means that these phobias are specific to some particular things. However, they bring about anxieties or worries or fears us. So let's go into the details. So what is specific phobia? And I would like to appeal, if you join and you are not speaking, kindly mute so that the feedback will not interfere with the presentation. Thank you very much. So specific phobias involve intense, irrational. So let's keep taking note of the words. It intense, irrational fears of specific objects or situations, leading to avoidance behavior that can disrupt daily lives. So the fear comes and it can be very intense, can be very severe sometimes. And the truth is, sometimes if you think about why the person is scared of this thing, doesn't really make sense about a specific object or a situation. And most of the times we usually don't pay attention to these things, or we don't usually feel that it can be a form of mental health concern. So this, when the individual comes in contact with this particular thing, it brings about some intense fear. And based on that, the person will do things to avoid those or that object or the situation. Because anytime it is surfacing, it brings about this fear. So the individual will do things to avoid it. And based on this, it can also go to disrupt his or her daily life. because maybe he must do this to enable him to do the next thing, but because of the fear of the object or situation, they will not do it, and they end up losing some aspects of their lives. So when you look at the DSM-5, I'm comparing the definition to DSM-4 and DSM-5. So in DSM-4, so the DSM-4 is the immediately reviewed statistical manual, diagnosing statistical manual in diagnosing psychological conditions. So those who are new to us, this is where we are getting this definition from, the DSM, that's the Diagnostics and Statistical Manual. So in the version 4, which is DSM-4, it says that it is a marked and persistent fear that is excessive or unreasonable. Marked and persistent. So the fear is persistent, not just a one-time fear or just a day fear, but persistent. That is excessive or unreasonable. Cured by the presence or anticipation of a specific, killed by the presence or anticipation of a specific object or situation. Example, flying. So that has a fear of flying, height, animals, receiving an injection, seeing blood, etc. So the individual's fears are around this object, either situations that will make them fly, like being in the aeroplane, or climbing height, animals, or receiving an injection, seeing blood, among others. And it is not too different from the DSM-5. So DSM-5 just made it simple by saying that marked fear or anxiety about a specific object or situation. Example, flying, height, animal, receiving an injection, seeing blood, etc. So the fear is around, not only limited to these, but these are some of the common ones. So mostly, the phobic object or situation almost always provokes immediate fear or anxiety. So anytime what the person has that fear for, anytime it comes up immediately, it doesn't delay for the person to now be scared later. Immediately the situation brings up itself, or the object surfaces, it brings immediate, or it provokes immediate fear or anxiety in the person. So the fear or the anxiety is out of proportion. So looking at how the person is reacting to the situation, it's like, if you think about it, it doesn't really make sense, or as the definition says, unreasonable. So the fear or anxiety is out of proportion to the actual danger posed by the specific object or situation and to the sociocultural context. So if it is about height, this same height, everybody is climbing, but the individual, how they are reacting to that height, it's kind of, in quote, unreasonable. And then looking at the norm, that's a cultural context in which the person is doing that, realize that the person is deviating from the norm, because this is not something we are used to in our settings or in our social cultural context. And then the phobic object or situation is actively avoided. If not avoided, then the person endures it. But the enduring comes with intense fear or anxiety. So the situations where they endure is that there's no way to avoid. So if I can't avoid, I have to endure. But they are enduring with a lot of fear. They are not within themselves at the time they are trying to endure that situation. So this is how the phobic or specific phobias come up. So there are two ways. Either the person is avoiding it, or who endure with fear or anxiety. So the fear, anxiety, or avoidance causes clinically significant distress or impairment in the person's social, occupational, or other important areas of functioning. So when the person is going through these things, this fear, anxiety, avoiding, rather that his or her social interactions will be affected. Relationship with people will be affected. Their occupation, that's their workplace. They come to work, and maybe let's take in quote, we'll be going to the specific. Let's take it if the person has fear for blood or fear for needles, and this person finds him or herself in the hospital settings, rather it's going to interfere with, and this person is a nurse or a doctor who will be seeing some of these things more frequently. So in situations like this, you can't avoid, but you have to endure. So the individual will end up enduring with intense fear or anxiety, and to be affecting his or her, how do you call it, her work. The fear, so in case of when we want to establish a diagnosis, the fear, anxiety, or avoidance is persistent. So why we've mentioned it at the beginning that it's supposed to be persistent, typically lasting for 6 months or more. So there's a baseline for diagnosing. So this behavior that a person is putting up should at least last for 6 months or more to be able to establish that this is a specific phobia that the person is going through. And then with those symptoms too, we should make sure that it is not as a result of a different mental health condition. So he's saying that the disturbance is not better explained by the symptoms of another mental disorders. Example, OCD, that's obsessive compulsive disorder. PTSD, that is post-traumatic stress disorder. Social phobia, which we discussed last 2 weeks. Separation anxiety disorder, which we'll be discussing today. In order to diagnose these specific phobias, they are saying that you should be sure that it is not any of these things. So you should be able to rule out very well that the person do not have OCD, the person doesn't have PTSD or any of these others. Can we please mute our backgrounds? Thank you. Social phobia among others. So those clinicians who are here should take notice that you should be able to scrutinize very well and rule out. We will be looking at OCD and the other conditions later. So I wouldn't waste much time over here. Mostly, as I mentioned, there are some general, there are a lot for the phobias, the specific phobia, there are a lot. Some are even yet to be discovered. There are a lot. But mostly people have the concerns around some 4 major areas. Some 4 major areas around natural environment. It can be around natural environment, animals, medical care treatment, or even other situations. So, for example, when we take the natural environment, for instance, we have one which we call the astrophobia, which is more excessive or irrational fear of thunder. So the thunder lightning. When the thunder is lightning like that, the individual may have this intense fear of the lightning. And this will make the person start having some reactions, panic reactions or anxiety-related reactions that doesn't really make sense. But the person will, and these things are, this is persistent. Some people have a fear towards water, and you are maybe swimming pool, and that's what we call the hydrophobia. So that's the fear for water. That's somebody's, and that's about the environment. Somebody's fear, the fear for water, and you want to understand what exactly is making, or why should a person should behave in that way. And mostly there is no answer. We have also what they call the dendrophobia, fear of trees. Imagine. So if somebody has this fear of trees, how would a person survive in the environment? So people with agoraphobia, for instance, may experience anxiety or discomfort when it comes to trees, or even just thinking about them, thinking about trees. So a person like this, if you have these flowers in their room, or you go to a place with these flowers, you disturb them because they have the fear for this specific object, fear for lizards, fear for dogs, horses. Like these are animals, around animals, and different. Going down to the medical aspect, the dentophobia, that's somebody who has a fear for the dentist. Extreme fear or anxiety of the dentist. So if they have a dental issue and they see the dentist, their panic start coming. And it can be very, very unbearable. Very, very unbearable sometimes. So we have the trypanophobia as well, for injections, hemophobia, that's blood, people who fear blood. So all these are there. So I mentioned the fear of dogs. You have social phobia. So the fear of, we've mentioned it earlier, social situations. The aerophobia, the fear of flying or any kind of plane. So if the person get opportunity to fly or to travel by plane, imagine how that is going to be. And we have some people having a deep or extreme fear for spiders or these insects. And then one common one is the acrophobia, which is a fear of height. So I know this list is not exhausted. Maybe I want to give 2-3 minutes, or just 2 people or 3 people to share, to mention any other one that they know, which you know, if you've experienced somebody going through. Which of the specific phobias do you know? Can we get some reactions, please? You can put them in the chat box, or you can say it out.
Okay. Hello.
Yes, hello.
Okay, so I don't know if this has been mentioned. Claustrophobia, like fear of congested places, where when you are in a place and the whole place is enclosed. And it's
Yes,
something I personally experienced. That's why
yes, claustrophobia
mentioned.
is there.
Oh, okay.
Yes,
Okay.
claustrophobia. So fear of
Yeah.
enclosed places, like the leader feels that they will be stuck in there.
Exactly. Like you can never
So
come out.
anytime they find themselves, especially finding yourself in a lift or in an
Yeah.
enclosed area, like they feel
Yeah.
there's no escape.
Yeah. So I don't use lifts.
Oh, okay. But the question is, have you ever got stuck in a lift before?
No, I have never got stuck in a lift before. So when I'm
Okay.
going in, I have someone who is very experienced. At least I'm a little okay. But if I have to enter alone, I don't try at all.
So the question is, why the fear? Why the fear if you're alone?
It's an idea that maybe the lights may go off and you get stuck and you can't open your you can't open it and you'll be there for a long time and you can't breathe and all that. I think I have one experience when I was in a plane and I had to use the
Okay.
washroom. You know, the washroom in the plane is very small. I already had this
Okay.
claustrophobia, so I was holding on to the wall. But when I finished and I wanted to flash, and immediately I tried opening the door, I couldn't open, not knowing some people had just blocked, they had just chalked themselves on the door, so I couldn't open it. I almost collapsed there. And they realized someone was like opening it. So all those ones
Mm.
are adding up to my fear. And even in STC, when
Mm.
I bought STC and it's about to take off and the whole place, I can't see anyway. I sometimes tend to scream sometimes, but I'm working on it. I'll be fine.
I'm happy to hear that you are working on it, and you will definitely
Yeah.
be fine. But you see, so as we are mentioning, most at times, if you are asked, sometimes there may be some experience. Okay, we'll go into the courses and all this stuff, but there may be some experience. So the individual will link an experience to all current situations. That because this has ever happened, it will happen like this. So it becomes a permanent fear for the individual. So just like he said, maybe sometimes we watch these things in movies and stuff, and it starts in the individual's mind. But that's why I'm saying these things should be persistent, and also interferes. Like for instance, we are very late and for an interview, and there is a lift which can easily just take you to the office, but because of the fear, you want to use the staircase, which you have to walk far to the fifth or sixth floor. So you say it is interfering with your daily activity or your occupation in a way. So this is what we are talking about. Yes, I think somebody wanted to also add some. uh, Musa Husseini, please, your question, maybe you have an answer to it. Can you unmute and speak to us?
Oh, okay. So I just wanted to find out whether there's a name for somebody who have extreme fear for women, like say some women are approaching them to propose to them and all that, to talk to them. Whether
Yes,
there's
if you read around, there is one phobia known as the feminophobia. You can read around feminophobia. So feminophobia has to do with somebody who has that fear or excessive or irrational fear of women. So like you're saying, they find difficult approaching or interacting with women. So anytime a woman comes around them, realize that they start having rapid heartbeats and trembling, sweating. Even if they want to start talking, they'll start stammering. So yes, we have feminophobia over there. Some people call it the genophobia. So yes, we have a phobia like that. Yeah, Nora says xenophobia. So Nora, can you tell us about xenophobia? Nora Blevy. Hello, Nora. So Gipsy Adjo Mensa, he said, at the sight of BP machine, my BP goes high. So that could be around the trypanophobia. That's fear of, I don't know if it falls in well. Fear of uh, needles, which can be related to those medical stuffs. Yeah, we could put it around those ones. So let me see. Abigail says, mine is with frogs. Even the tiniest toad scares me. Either in books, or books dead or alive. So fear of frog, that is some people says ranidophobia or bacterophobia. There are a lot of, if you should search, the phobias are a lot, which we can't really, so just what you need to identify the one that you feel you experience, then you see a therapist and we look at it. Maxwell, your hand is up. Can you talk to us?
Yeah, thank you. So mine is, I want to know what kind of phobia is given to people that fear crowd. Particularly, maybe you are
Can
such
you
a
come
person
again?
that I mean, what kind of fear is given to people that fear crowd.
Okay.
What kind of phobia? Because some people are there, especially in church, or when they see strangers, though they know everything, but immediately they see them, they can't do anything. Maybe in the church, they ask a question, they have the answer, but they will never talk because they fear the crowd. I want to know
Yes, so
what also causes
there's a phobia like that. So the fear of crowd, not about the crowded place, but the fear of just a crowd in itself. So which is the oculophobia or demophobia. So there are specific phobias like that. People have that particular phobia when there's that intense fear, when or discomfort, when they see crowd coming like that. So yes, and then one common one is the glossophobia, which is the fear of public speaking. There are some individuals that when they are to stand in front of people to have interactions, it's a whole lot of hell for them. So we have people who also have that phobia as such. Yeah, so we have a lot to do. So we'll move on. Maybe when we have time, we'll come back to explore more of the specific phobias. And thanks for, I can see a lot of comments as well, but we'll revisit them later. So causes, someone is actually writing on our screen. I don't know who. So just as we mentioned for all the other anxiety disorders we've discussed in the past, same way with the specific phobias, so sometimes it can be genetic related, that family history of phobia or any anxiety disorder can make the person susceptible to also developing these phobia later. There could be other environmental factors like, so as I mentioned, some people based on the experience, past experience in relation to the particular object. So the person who has a fear of the closed space, like the lift, for instance, probably in a movie or he has heard in the news or was involved before where the light went off and people got stuck in the lift. They have to take time, and all perceptions around or conceptions around that can make the person to have that phobia. So based on the past trauma that the individual experiences can bring about that. Developmental factors to some phobias can emerge during childhood or adolescence. So some kind of upbringing and yes, childhood experiences can make the individual also have that shaped mind towards some of these things. So as we mentioned, complications, it can impact on daily activities or function of the individual, the person's relationships, and overall quality of life. It can increase anxiety and the potential development of other mental health conditions. So sometimes there are some things that may be triggering it. There may be some triggers to it.
Come on, stop moving as if it's a car. Meanwhile, your things are in this. Remove them. Obia was so to be anything away you quit.
If my co-host can mute people who are interrupting for us, I'll be glad. Thank you. So there can be some triggers to some of these things. So, for example, just the sight of the object brings about the fear or triggers the reaction in the individual. Sometimes if it's a thing around food and all those stuff, the smell alone will trigger. So the individual just needs something to just trigger it or to just spark it, and then the fear comes. Sometimes it's not even with the sight of it. The person doesn't even see it, but just the imagination that, so like one person mentioned in the chat box, even sometimes in books, even seeing the thing in books, the person imagines that it's actually happening to him or her. So someone with a fear of snakes, for instance, imagining how an encounter with a snake would be like, immediately affect the person. The person will start reacting right now. Just the imagination, the thought, like, hey, so if this native to come, how is it going to do to me? Immediately they have an anxiety attack. And then the anxiety reaction that we've been talking about, the sweating, the tremors or the shaky, and all those stuffs will start coming. Sometimes it can be the sound. Can just be the sound of the feared object, and the reaction comes. So still around food, sometimes not necessarily about the smell, but it can be the taste. It can just be about the taste of the food, and then the individual will start having that particular fear. So there may be triggers. So it is good to be able to work out these things. One, you should know your triggers. When you know your triggers, it helps you to know how to manage the situations. So some of the signs could be sweating, shortness of breath, feeling out of control, dizziness, feeling overwhelmed, as if you want to vomit, that's nausea, some chills, rapid heart rate, sometimes sudden panic attacks or overwhelming dread, just with the thoughts or the sight of the panic object, then you start having panic attacks, upset stomachs, rather that your stomach will just start giving you troubles. And so mostly the individual want to avoid the situation. As we mentioned earlier, either you avoid or you endure. But in enduring, it comes with a whole lot of work. Taking longer routes to avoid the location. Difficulty breathing, which we've mentioned. Excessive sweating, taking or rapid heartbeat. Tense and swollen muscles. Sometimes the individual muscles can get tensed up. And dilated pupils, increased heart and breathing rates. All these things are physical reactions to some of the feared objects. So in management, yes, so therapy helps in managing some of these things. Sometimes medication may be a last resort. So if managing with all the other forms of therapy is not yielding, you can be recommended to the psychiatrist who also consider medical care, medications to help manage the anxieties behind it. So cognitive behavior therapies, which involve identifying and challenging the irrational thoughts and beliefs related to the phobia. So the thing, when you see the object, what makes you think? Probably the way you are thinking about it is faulty, it's actually not right. So a therapist will help you to identify those irrational thoughts and then help you to change them in a positive way so that next time it doesn't provoke anxieties again. Sometimes exposure therapies also works. So somebody who, let's say, fears height, the person can climb 2-3 steps or floors. So you can subject the person to an exposure therapy, maybe where you aid the individual in reducing fear and developing positive associations with the phobic stimulus or object with systematic exposure. So you don't just push the person towards the thing, or you just don't flag the individual like that, but gradually in systematic way, you'll be exposing the person gradually, and then you'll be able to get used to the feared object. The systematic desensitization, that's combination of relaxation techniques and then exposure therapy. So with the desensitization, so as you expose them, or even before you start, you do relaxation exercises, you gradually expose, you do relaxation exercise. So in between there, relaxation exercises and exposure in that gradual way, and with time, the individual gets used to it. You also have the visual reality exposure therapy, which is a technological assisted system, which helps you to also work out this. And I mentioned medication sometimes too. and a combination of medication and then the psychotherapies helps a lot. So that is on specific phobias. The next one we want to talk about is agoraphobia. So agoraphobia, what is agoraphobia? It's an anxiety disorder where people fear situations from which escape might be difficult, leading to panic or feeling of being trapped. I think someone mentioned, so some of these other phobias, when it takes specific phobias, some of them fall in there. So just that the diagnostic manual tried to pick them and make them stand alone conditions. However, some cut across in the specific phobia. So agoraphobia, as you are saying, is where the individual fears situations from which they think they cannot escape. So like for instance, the lift you are talking about, the person feels they can't escape or they feel trapped. And then that will bring about a panic to them. So common triggers include crowd. So somebody mentioned or asked a question about crowd, fear of crowd. It also can be a trigger to this. So that the person sees that there's crowd forming or crowd is here, the reaction starts. Public transit, so like the STC bus you're talking about, the VIP bus, the whatever transport system the individual is taking, because they feel when anything happens, they can get trapped in there. Even sometimes they have the fear towards open spaces because they feel when something happens, there'll be nobody to help them. So they see themselves alone in that open space, and it can also be an issue. Or even being away from home. When they're out of their house, they feel something will happen to them that nobody can help them. So these things can be a trigger to the fears. People with agoraphobia avoid these situations, which can severely disrupt their lives. So I want us to look at a difference. So last 2 weeks we looked at social phobia or social anxiety disorder, which I want us to be very sure we are not mixing up. So there's a thin line difference between agoraphobia and social phobia. So under agoraphobia, there's that abnormal fear of being helpless in an embarrassing or unacceptable situation that is characterized especially by the avoidance of open or public places. When we come to social phobia, fear of interaction with other people, that brings on self-consciousness. So with the social phobia, it's not about the place, the space in particular, but it's about what people will say about them when they're interacting, the thought they're having, what people are saying about them in the social setting. That is where the difference is coming from. So it's not just about the space, but it's about the interaction. So the fear of interaction with other people, that brings on self-consciousness, feelings of being negatively judged and evaluated. And as a result, leads to avoidance. So that is with social phobia. Then we take agoraphobia to experience panic symptoms anywhere outside his familiar or comfort zone. So far as it's about a space where they will feel trapped or they feel no escape, in anywhere they experience the panic symptoms. However, under social phobia, they experience symptoms of anxiety and avoidance only during social interactions. So if they are not interacting with anybody, they don't have any fear of the space. So they can go to the public space, all right. So far as they are not going to do any delivery, talk to anybody, they are fine. So under agoraphobia, based on the fear of the space, they want to avoid those places or avoid unfamiliar places. And with social phobia, they have no demarcations for place they visit. So they can visit anywhere, but the only problem is that they don't want to interact so that they'll get embarrassed because one, they believe that whatever they're going to say will not be just or will not be right. People will look mean upon them. So, and then under agoraphobia, they worry about scrutiny from others when they go through panic attack in public. So when they are reacting to the space over there, they also feel uncomfortable when people are talking about why are you reacting like this and all those stuff. And under social phobia, the worry is about being criticized or rejected by others. So it's not necessarily about the space or how they are reacting, but the thought of what people will say about them. So that is the difference I want us to see between agoraphobia and then the social phobia. And what causes it? Just as we've mentioned, these things run through most of the anxiety disorders. So genetic predispositions, trauma or past experiences can be there. Parental overprotectiveness. Sometimes parents will protect their children, overly protect their children against some things, and they then develop some fears around those particular things. Maybe you just don't want your child to be playing with, let's say, needles or something. I'm just trying to. Then you create a fearful way of making a child avoid that thing. So anytime the child sees that, they associate it with some terror. So as the child is growing, that situation keeps growing, and they feel that no, this thing comes with terror, or it's dangerous to do this. So gradually the child will now be shaping and having that mindset that this object or this situation is like this. And then adverse childhood experiences, dependent and avoidant personalities. Sure, so sometimes personality disorders can also be contributing factors to some of these things. And some common risk factors include history of panic attacks, traumatic, and other mental health issues too. So as we mentioned, sometimes there may be other mental health conditions that are making a person have these panics. So we should know about that. Then with the symptoms, just the same anxiety symptoms, they also go through rapid heartbeat, shortness of breath, dizziness or faintness. They'll faint in situations, sweating, intense fear or anxiety, feeling of helplessness, especially when they are in the public spaces or the enclosed spaces like that. And then most often they want to avoid anything that will bring about that, anything that will put them in the space. They want to avoid it. So they don't even want to leave home at the first place. Example, they wouldn't want to leave home because they fear when they go out of their homes, there'll be nobody there to care for them if there's any danger. So they want to avoid that. And treatment options to ask the psychotherapy helps as well. The CBT, the exposure therapies, medications are also there that helps. And mindfulness, so some mindfulness and realization techniques, which I actually wanted us to do one, but I think our time will not permit us. We can't finish our slide today, so we'll do that on our next presentation. Yes, so let me just we have 5 minutes to finish and we take questions and interactions. So let me do separation anxiety disorder, and we'll do selective mutism on our next meeting. So separation anxiety disorder is also one of the anxiety disorders that people experience. So what is it? So separation anxiety disorder is a psychological condition primarily seen in children characterized by excessive fear or anxiety related to separation from primary caregivers or home. But I want to mention that, yes, children, but some adults also experience separation anxiety. So we call it the adult separation anxiety disorder. Instead of SAD, they have ASAD. And this presentation will point us on a few adult separation anxiety disorder issues. So we are saying basically when it comes to separation anxiety disorder, it's characterized by the excessive fear or anxiety related to separation from primary caregivers. So like the child, their mom, who the person who is their primary caregiver, they have that bond to the extent that they fear separating from the person or even leaving home. So we are saying that it is normal for children to experience some anxiety during separation. But when it comes to separation anxiety disorder, it's marked by the intensity and duration that is developmentally inappropriate. So looking at the child's age and having that fear of being left by parents, it becomes questionable. Let me get water. Yes, so I was talking about children experiencing this thing, but looking at the age, their age and the behavior doesn't really match. So in children, this can be noticed at various ages actually, but typically starts to manifest around 18 months to 3 years thereabout. So we're expecting that at this point, the children should be able to stay with other people, siblings, other people in the house. If their mom is not there, they're able to. But in this situation, if the mother or the primary caregiver is not there, they find it very difficult. They will cry throughout. But I say that this is normal. This is a normal developmental phase. When you're talking about the 18 months to 3 years, you can see it to be a normal developmental age. And most children outgrow it by around 4 to 5 years. So when from 4 to 5 years, they're able to come out of this. But if after these 5 years and this issue continue, where they are not able to be themselves when parents are not there, there is a serious issue that may have to be looked at, and it can transcend into the person's adulthood when they are old. So symptoms include the symptoms of separation anxiety disorders are more intense than what expected for a child's age and can cause significant distress at home, school, and in daily life. And as we said, symptoms vary from child to child, and experiencing just one or two does not mean a child has separation anxiety disorder. Emotionally, there may be that persistent worry. So children may constantly fear that something bad will happen to their attachment figure. That is, example, their parent. So that's what the fear is. So they fear that something will happen to their attachment figure, or that they will become lost or kidnapped. So something will happen to them if the person is not there. So it's in these two forms. One towards the attachment figure, and second towards they themselves. They feel the person is not there. Something bad will happen to them. Either they will get lost or they'll be kidnapped. So there's that fear of being alone. This can manifest as extreme distress when left alone, or even in the company of others if their primary caregiver is not present. So they can be with other siblings, but they are just not fine. They want the primary caregiver, the parents, or the person they consider to be the attachment figure must be present. They can experience nightmares. Frequent nightmares involving themes of separation can disrupt sleep and contribute to anxiety about separation. Then the behavior symptoms too. So they may not want to even go to school. Children with SAD often refuses to go to school or participate in activities away from home due to the overwhelming anxiety. Physical complaint, they may frequently report physical symptoms such as headaches or stomach aches, especially when separation is anticipated. And they can be very clingy. They get cling to their caregivers. And sometimes they can follow them to wherever they are going because they can't just be alone. We've mentioned most of these already. Refusing to go to school, extreme stress when saying goodbye. So they can't, when you are going somewhere, so bye-bye, it's difficult for them. Frequent headaches or stomach aches with no clear cause. Meltdown at drop off. So if you take them to school and drop them off and you are leaving, it becomes problematic. They can cry throughout. Constant worry about caregivers' safety. Withdrawal from peers or activities. Nightmares about being separated, clinginess, or following caregivers around the house, among others. So according to the DSM-5, symptoms must last for at least 4 weeks for children and be inappropriate for their developmental level. The anxiety must cause significant distress or impairment in social, academic, or other important areas of functioning, indicating that it interferes with the child's daily life. So consequences of separation anxiety disorder: poor school performance. It can result in other anxiety disorders if left untreated. Low social performance and high social anxiety, difficulty initiating and maintaining friendships. Family activities are limited by behaviors associated with SAD. Parents of children with SAD have little to no time for themselves or each other because always they are clingy. You don't allow your parent to do anything. Siblings become jealous of all the extra attention given to the child with the SAD and causes, as we always mentioned, family history can be a contributing factor. Environmental factors could also be major life changes. Events such as moving to a new home, changing school, or parent divorce can trigger some of these symptoms. So when there is separation or divorce in the home, sometimes affect children. Trauma or loss, experiencing the death of a loved one, separation from a caregiver, or other traumatic event can lead to heightened anxiety surrounding separations. And parental behavior, overprotective or anxious parenting style can model avoidance behaviors, reinforcing a child's fear of separation. Then in adult, as I mentioned, adult separation anxiety disorder involve excessive fear or anxiety about separation from attachment figures. So same attachment, so it can either be their partners, their parents, or even some friends. Some people can go to school and go and make some friends that becomes an attachment figure that without them, they can't do anything. Leading to avoidance behavior, worry about harm to loved ones, and physical symptoms like headache or stomach aches. The symptoms must cause significant distress and interfere with daily life, such as work or relationships, and have persistent for at least 6 months. We've mentioned that in the past, for a diagnosis to be considered in adults. Common signs include refusing to go out of the house, being alone, or sleeping away from home, and a persistent worry about loved ones. So sometimes, if their relationship, the other partner sometimes in quote suffers because they can't just avoid. They can't just see the person leave them, because when the person leave them, a whole lot of thought comes to them. Either the person is going to leave them, it's going for another person, and all sort of thought comes. So they feel very insecure being alone. So symptoms in adults: excessive distress when separated from or anticipating separation from attachment figures, persistent worry about losing attachment figures, or that they will experience harm, refusal or reluctance to go out, be alone or sleep away from home, reluctance or refusal to go to work or school because of separation fears, repeated nightmares about separation, physical symptoms like headaches, stomach aches, or dizziness during or anticipation of separation, and difficulty with boundaries, sometimes appearing clingy or overly involved in a partner's or child's life. Sometimes even a separation figure could be their child, where they can't just stand it when their child is being taken away from them. And with the treatment options, it also follows that you have psychotherapy, medication, and then parental involvement, especially with the children, with some. And when it comes to the psychotherapy, one very important therapy that helps children is what we call the play therapy. So particularly effective for younger children. This method allows them to express their feelings and fears in non-threatening ways through play, helping them to process their emotions. So we give them these toys and let them be in a friendly environment, an environment that they're able to explore by themselves, and with the presence of a professional, which can help them non-destructive environment, and they're able to bring out their emotions through the play that they do. So play therapy also helps in managing some of this anxiety in children. And talking about parental involvement, engaging parents in the treatment process is crucial. So parents can learn strategies to support their child, reinforcing coping techniques and reduce anxiety-provoking issues. When there is timely and appropriate treatment, many children can successfully manage their anxieties. And then early intervention is key, as it can prevent the development of more severe anxiety disorders in the future. And then many children can outgrow their symptoms as they develop coping strategies and gain more independence in life. So children are able to outgrow it when they experience. But so when an individual is not able to outgrow it, that's why it reflects in their adult life. All right, so that is where we'll end today's presentation, and I will allow for questions, contributions, anything. Yes, so we looked at specific phobias, we looked at agoraphobia, and we also looked at separation anxiety phobia. You can ask questions now. Oh, someone says they can't hear me. Please, is it the same for everybody? Can I be heard?
I can hear you, please.
Okay, someone put
Also
in the chat that no sound. Okay. All right, so please, ladies and gentlemen, yes, contributions, questions. In a few minutes, we are going to watch Ghana Blasters. Okay, so Nora came back to the chat. It says xenophobia is when someone is afraid of a hostile towards foreigners or people who look, speak, or act differently from them. All right, thank you, Nora. Perry says, following from Zambia. Thank you, Zambia. Nationals, we are glad you are here. Okay, please, if you have any contributions, come unmute and speak to us or put in the chat box. Okay, however, if there are no questions or no contributions, maybe I think I can use the next 5 minutes to do the last part so that we close docket on the anxiety series. So let me just complete and then next week we'll take a different topic.
Hello.
Yeah, hello.
Yeah. Thank you very much. My name is Norbert. I would like to ask a question regarding social phobia. In a situation whereby someone kind of what do you call it? You introduce the person to the phobia, the social phobia, and then the person still persist and then still always fear the object. What are the other alternatives that you could use to help the person?
So you're talking about social phobia. So as we said,
Hello.
and then we also
Hello.
yes, please let me
Yes,
respond
please.
to Albert. So we are talking about social phobia. So we try to differentiate social phobia from agoraphobia. And we are saying that in social phobia, the fear is that the individual feels that when they are in a social situation, people are judging them or people will judge them or those criticize or scrutinize them in negative ways. So they will rather want to avoid interacting in social situations. So most often, and usually realize that when you see what brings about some of these things, more about issues of confidence, self-confidence, and then esteem, low self-esteem, where the individual feels that they see themselves less of themselves, so they are not able to, they don't have that confidence enough to speak, and they always feel like they are not good, and that whatever they say or do in social settings, people will talk about it, people will talk negatively about it. So that prevents them from interacting in social situations. So even it can even transcend in when it comes to doing presentations in front of people, because they feel that they'll be scrutinized, they'll be told they didn't do it well, and that they'll start having all sorts of anxiety issues around them. So to help a person like that is to help train the individual to be able to manage their confidence level, their esteem levels, and help them to gradually take up social interactions. And then so some of the therapies we've mentioned, even why is the person thinking that they are not, people will scrutinize them or judge them wrongly? Some, it could have be the thought pattern that the person is maybe having this all or nothing thinking, or all sort of these cognitive distortions. They are either discontinuing positive, so they don't see anything positive about themselves. They're always looking at the negative. So a person like this, you can take them through a cognitive restructuring and help them change that thought pattern. And then also you can also help them with the exposure therapy, where you start exposing them gradually to social situations where they interact gradually, and they become very good in doing so. So there are a whole lot of things that can help somebody with social anxiety to come out of it. The best is to see a therapist and the individual will be helped. Thank you very much. But if you have a follow-up question or if anyone has a contribution, please, we can do so. MD Chantel Ayenso Fair, please kindly speak to us.
Hey, thank you so much. Good evening once again. This is for clarity and confirmation. I want to ask about the separation disorder. Could it also be the reason why some other grown-ups in their relationship, when they realize their partner is about to travel or something, they put in certain behaviors that sometimes are unhealthy? I have an issue at hand with a client who says he traveled from the United States and he's back here in Ghana. And as soon as he came, the wife actually told him that they should divorce. And at the moment, I just felt like, could it be something like that? Could it fall under, though they may have had their issues, but how is that as soon as the husband rather goes in here in Ghana, now the woman wants to separate, like wanted separation. So this is for clarity reason. Thank you.
Yes, thank you very much. Yes, so at the face value, it perfectly fit under adult separation anxiety disorder here. However, we are talking about how consistent has this behavior been. Is it that anytime the husband is traveling, then the behavior comes up? We have to be interested in knowing that and what are the specific things that the individual does. So yes, at a large extent, this individual may be experiencing this separation anxiety disorder, but as we mentioned that there can be other comorbid disorders that may be presenting in this form. So a personality disorder like the avoidant personality disorder. So where this individual feel they are not, maybe they fear that they'll be left, their partners will leave them. So it can that be a personality issue or it can be an anxiety issue. So we'll have to actually look at the specific issues in there to see if it is the personality issue of avoidance personality disorder or separation anxiety disorder. However, each of them can be triggering factors. The personality issue can be triggering the anxiety. And then anxiety can also be a contributing factor in the personality issue at that point. So where this individual is actually showing symptoms around this particular thing. And as we said, when a person is so, they put up those behaviors because they fear that if the person goes, something bad will happen to them. Or something will happen to the person that is living. So this is the few things I can say. So yes, it can.
Yes, I'm grateful. The confirmation is clearer now.
All right, thank you very much.
Yeah, thank you so much.
Please, any other contribution, question? Christopher Agbemenya, please speak to us.
Yeah, all right. Good evening and thanks for the opportunity. Just a quick one on the question our sister just asked and you responded. Now there is this. I had a. I don't know if I should call it a client. Yeah, I had a client. I do educational educational guidance and counseling. And then youth and adolescent guidance and counseling. So I had this client one time that the father had an accident and died through the accident. And unfortunately for this child, she was on board the vehicle, the car. So when she grew up, um, she was about getting married, or she about getting married, or she married a year, and the husband wanted to buy a car. She did everything to prevent the husband from buying from buying the car. So when I heard the issue, and then someone referred her for counseling, and talking to her, I realized that yes, she had this disorder from childhood. So she's scared that she would lose the husband in case he is driving. But really, what is surprising is that when she onboards a car, the fear of losing her life is not compared to when a family or a relative is actually driving the car.
Okay.
So when, for instance, when she's in a car with you, you are the family, you are a friend or something, and you are driving, that anxiety of accident and she will lose you. So because of this, she prevented the guy from buying a car. So there was this time that the guy wanted to travel outside for, is it a scholarship or a business summit or something? She did everything to stop her because she's scared that the aircraft might had an accident and something would happen. So you realize, so we took her through a lot of counseling sessions, and we realized a whole lot of things, and then we need to refer her to another counselor who took care of her. And the last time I heard from her was quite far, and she's doing well. Let me say she's doing well now, better than before. So anxiety, like you took everything from the beginning. There are a lot of people who have a lot of anxieties. This particular one is escaping me. There is a name for the anxiety of loss of the loss of business.